October is Breast Cancer Awareness Month. Today we have Dr. Elizabeth Riley in studio to talk more about the risks and the preventative steps we should all be thinking about right now. Thank you so much for coming in today, Dr. Riley. We appreciate it.
Thanks for having me.
So let's start first with some of these warning signs. What might someone notice that means it's really time to get into the doctor?
So know what your baseline breast exam might be like, what the skin looks like, what your nipple looks like, if there's any lumps that come and go with your cycle, any kind of skin changes or swelling to the area, any changes like that should be brought to the attention of your physician.
And we know in this case, there are some risk factors, more people more at risk. What are some of those?
The most common risk factor is family history, meaning if you had a mother, a sibling, a child with breast cancer, that's a very strong risk, although a majority of women diagnosed with breast cancer have no family history. So it's important if you have any of those physical exam signs that you seek medical attention, even if no family history is present.
And what are the ages that you see this most commonly in?
Most commonly it's after menopause, but we're seeing an increasing trend to more women between the ages of 40 and 50 with mammogram, or excuse me, with breast cancer. And so the governing societies have changed the guidelines to start screening at age 40.
Okay, and that's good to know. So let's talk more about these screenings. We were just talking about it, how important those preventative screenings can be.
Mammogram is incredibly important because it can not only detect cancer, but it can detect it at earlier stages. The earlier stage you're diagnosed, the more easily you can be treated, and in some cases, the more likely you are to be cured.
And what does treatment look like here? What are the options if someone does get that news that nobody wants?
So there's lots of different types of breast cancer, which a lot of people don't realize. Each different type requires different treatment. The best advice I could give is to seek a place of care that has multidisciplinary care. Sometimes you require chemotherapy, sometimes you can omit chemotherapy. Sometimes chemotherapy needs to happen before surgery, sometimes it can be given after. So finding a doctor or a team that can look at the case as a whole and decide the sequence of how things need to go is very important.
And I know you guys do that great work over at the Brown Cancer Center.
That is something that we do very well, yes.
Awesome. Well, thank you so much for coming on. We really appreciate it.
Thank you.
So we do want to tell you about this. If you're looking to get checked out, UofL's mobile screening unit is traveling through the county right now to provide convenient access to treatment. Just like we heard, it is extremely important to be examined regularly to catch any potential cancer very early. So the mobile screening unit also looks to give healthcare access to underserved areas, including West Louisville and South Louisville.
We know that early detection is the key. It gives us more treatment options. It has better survival rate. So we really try to emphasize to women to stay on their routine cancer screenings, for all cancer screenings, not just breast, but also your colon cancer screenings, skin cancer screenings. But right now, we really want to focus on breast cancer.
Well, you can see where the mobile health unit will be next on UofL Health's website.